that's what I want to talk about today. I want to talk about those materials. What materials do you believe it's the best for a hybrid? What materials nowadays, today, do you believe is the best option for our patients, and why?
Here in supremedental, we have a lot of patients. Every day is a different patient. Every day is a different history. Every day is a different challenge. We have the opportunity to check a lot of x-rays, a lot of different CT scans. That's why we have experience.
Zirconium, full zirconium, or zirconium with titanium?
Titanium bar.
Titanium bar. Either one, it's a great option in the clinic.
So it's because of our technology that we're able to do the direct connections. Is that what I'm getting at?
That is correct. Yes.
We're gonna deal with it, and we're gonna solve it, and that's the place that you want to go to. That they're gonna be with you on your dental journey from the beginning, during, and after.
The thing about bacterias is that bacterias are always gonna be able to attach themselves to rough surfaces.
Okay.
Right. If it's either any material.
Yeah.
And the thing about PEEK, it's that it's a thermoplastic.
It was all a dream. I used to read Word Up magazine. Salt and pepper and heavy D up in the limousine.
Welcome back to Supreme Dental Podcast Studio. You can be anywhere else in the world right now, but you're here with us. We appreciate that. Don't forget to like and subscribe. My wife and I are the owners of Supreme Dental Clinic. Listen, we're on Apple Podcasts and we're on Spotify. Tell your family, tell your friends. This is the place for all your dental needs. And today we have Dr. Luis.
Hello.
And we have Dr. Elias. How you doing?
Hello, somebody. I'm doing great. How about you?
Buddy,
Hello, somebody.
superstar.
Somebody.
We have Tejas, T-Baby over there.
Botellas.
JT. Hello. And today, we have a podcast from months and months and months ago. I believe this is episode, what is it? 81. And I don't know what episode it was that we talked about the differences of materials on the prosthesis of an all-on-4 and all-on-6. Obviously, since then, a lot of things have changed, as well as now both of you do pterygoid implants. Both of you do zygomatic implants. And I'm pretty sure in the very near future, you're going to be doing quad zygomas. Going back to that, we talked about the difference of materials. What materials would you pick? What materials do you think they're the best? And that's what I want to talk about today. I want to talk about those materials. What materials do you believe it's the best for a hybrid? What materials nowadays, today, do you believe is the best option for our patients, and why? Who starts it out?
Well, when we have a structure with all-on-4, all-on-6, we need to use a strong, very strong material. For example, time ago we are working with Serpic, but the Serpic has a different components. Maybe 4. The PIC is a plastic. The pink color is like a composite. The abutment and the crowns.
I'm sorry, somebody's doing some construction and they're like really going at it next door or something. We always pick the right days.
Yeah.
But keep on going, man. Keep on going.
Here we have 4 different components in one structure.
Okay.
With this situation, we have the risk to lose something. For example, the pink color, the composite, or any crown. But in my opinion, the best option is to use a monolithic structure. For example, zirconium. With the new system, we can use a full zirconium structure. We don't need to use another type of abutments. We don't need individual crown. We don't need another, just the color, the stain, but no more components. With this option, we can to prevent any fracture or the patient lose any component, any crown or something. It's a best option. Less is more.
Well,
Yeah.
it makes sense. If you have a lot of other components, there's a lot more chances of something not going right.
Right.
And by doing something monolithic, as the zirconia bars,
Yeah.
there's only one piece. So it's a lot more secure, a lot less failure percentage rate that could actually happen.
Right.
What do you have to tag along there, Dr. Les?
I think Luis hit it right on the spot when he mentioned the workflows.
Okay.
It all depends on the workflows that you're managing, and now that we have photogrammetry, that we've mastered photogrammetry in our workflows, we definitely believe, and we're 100% sure, and not just us, but people around the world. And I know we beat that to the drum, but we're always seeing what the best clinicians in the world are doing, and what the papers and whatever studies out there, and with the workflows that we have with photogrammetry, how we're able to capture the exact position and angulations of the implants. We're able to do a monolithic prosthesis that has direct connection from the prosthesis to the multi-unit abutment, from the connector of the implant to the prosthesis. There's no in between. So what this does is that there's sometimes we have to place, if there's a zirconia bar but you don't have photogrammetry, it's not recommended to do direct connections, because by the very minimal amount of that it's not accurate, there's a bigger percentage that it's going to break, because it's so hard. Zirconium is so hard that it doesn't have any elastic properties, that if it's not fitting properly, it's going to crack. That's where photogrammetry comes in, and everything is so passive and everything just fits so perfectly that we're able to do direct connections with monolithic zirconium. One of the advantages, one of the many advantages, is that it's very aesthetic. It looks very good, and we're able to handcraft gum details on the teeth, but also biologically, the gum is able to attach and create that first barrier where it's going to protect the implants. The gums can actually attach to zirconia, and it's going to be the first barrier of protection to the implant, so no bacteria can go in. So there's a lot of advantages when we do zirconium versus other materials. Zirconium, full zirconium, or zirconium with
It's
titanium.
Titanium bar.
Titanium bar. Either one, it's a great option.
Great option.
Though, this is not something that it's opinion. It's something that is a fact. Dr. Ed Bedrosian, they're prosthodontic dentists in the U.S., and they do a lot of research. And they say that when you're going to do a full bar of all-on-4, all-on-X, and it's more than 22 millimeters of thickness, that it's considered to do best with the titanium bar.
Titanium bar.
If it's less, there's no issue with that. So we've jumped on the bandwagon. We jumped on this technology-driven protocols that have given us best results, and we're doing full zirconia bars here at the clinic.
So it's because of our technology that we're able to do the direct connections. Is that what I'm getting at?
That is correct. Yes,
Right.
You can do direct connection without photogrammetry.
But there's a higher percentage of breaking.
yes,
Yeah.
a very high
And that's why back in the day we used to take impressions.
yes.
In photogrammetry, it's a lot different. It's a lot faster. It's a lot more accurate.
It's a lot. It's both
Both, yeah.
faster and accurate. It's
Yeah.
both.
That's what the pig dental does, right?
Yes.
Right.
Okay.
And the Shining 3D.
And the shiny 3D and whatever comes out by the time this podcast comes out. 'cause
Yeah.
Yeah.
Technology is moving real quickly. What about looks, guys? So acrylic, we no longer do the metal acrylic because
No.
we know that was a throwaway. Teeth would pop out. Recently, we seen one that broke in half.
Oh yeah.
That was weird.
Yeah.
It's a very popular problem, the acrylic with fractures or broken.
Because you have three different materials, right?
Yes.
We had the composite teeth, you had the acrylic,
The gums.
and then you had the metal
The
inside.
The metal,
the metal bar.
So it was three different things going on at the same time. Obviously, you bite down, a tooth's gonna pop out.
Yeah.
Normally from the front, right?
Right.
What about Zerpic? You know, Zerpic it's a good option also. But what have we seen with studies and with us looking at Zerpic? What have you guys seen? And is it a top option, or why is it no longer a top option?
No, no longer. When we are removing the pig, we can see like what's the name? The fungus.
Fungus. Yeah.
Fungus inside. It's like a black shadow. Always is the same situation with the pig. I don't like this problem. That's why we are recommending when we have any patient with problems with the Zerpic, we are changing for a better material. In
Yeah,
this case,
they can upgrade to zirconia. Yeah.
to zirconium. To zirconium. Yeah. When I show the peak, can you see the problem now? Oh my gosh, it's a big problem. Can you give me another option? We are recommending.
In the pick, how many different materials are in the Zerpic?
On Zerpic, there is
Is the peak? The first is the abutment.
the abutment, so we have one.
The
The actual
pick,
pick bar,
the peak bar,
the teeth, and the gingiva.
and the gingiva. Yes.
So the gingiva, the pick, and the zirconia crowns that we cement on them, right? Little nubs.
And the tie base.
Oh, and the tie base
tie
because
base.
it's not
the abutment. Yeah.
it's because it's not milled. Well, no, is it not milled? The Zerpic cannot be milled.
It technically can, but it's easier for it to break.
Yeah.
The thing about
It's a small. It's a very thin part.
the thing about bacterias is that bacterias are always gonna be able to attach themselves to rough surfaces,
Okay.
right? It's either any material.
Yeah.
And the thing about PEEK, it's that it's a thermoplastic. So thermoplastic, for as good as you do it, or as it's not a smooth surface. So it creates a perfect environment for bacteria, for fungus to actually attach itself. The mouth, it's a warm place. There's water and a rough surface, so you're actually inviting the bacteria to actually stay in that prosthesis,
Yeah,
right?
prosthesis,
The thing about zirconium is that it's so smooth that there's no roughness to it, and bacteria cannot attach to it.
So, as me not being a dentist, better understanding for me is like the floor outside your house. If you have that floor that has a lot of different
Carpet.
designs or different things like that, dirt can get stuck to it.
Yes.
So when you're watching your porch outside, you know, if you have the tile that's smoother, you know, even air removes the dirt. But it's or water, you could just splash it and everything wipes off. But the one that have all those designs in and different angles and stuff like that, the dirt gets stuck right there, and you have to actually would brush it off because you can't pressure the water off of it. And on this being grafted onto the implants, you can't really brush inside, so that forms
Right.
fungus.
Is for example, when imagine I put a lot of food on the
A lot of food on the bricks.
The bricks. It's a challenge to remove all the food, but if I put the food here in this surface, we can clean much better. It's more easy to remove the food here.
So I just did an example for about a minute and a half, and then he just does an example for like 10 seconds and kind of just like,
Yeah.
you're not allowed to talk in that was good.
Yeah. What I've also seen with Zerpics is that teeth break,
Oh yeah.
and it's a very easy explanation, right? You have a surface that's holding on to the prosthesis, which are the implants, and the implants do not move. So it's then you have the prosthesis that's thermoplastic that does have certain flexibility to it, right? And then you have the zirconium teeth that have no flexibility.
No, it's very hard. It's hard.
So now you're applying pressure to all of it, right?
Yeah.
So what's going to happen? The teeth are don't have flexibility. The bar has flexibility, and the implants don't have flexibility.
Yeah.
So that pressure has to go somewhere.
Yeah.
If the bar is flexing, it's gonna flex on the teeth that don't have flexibility, and what's gonna happen? It's gonna break the teeth.
Break the teeth. Yeah.
So and zirconium doesn't have that because everything is doesn't have any flexibility. It's not gonna break.
You know, it's having this type of technology obviously gives us so many other routes to be able to go to. You're talking about the little sleeve where you have the prosthesis, the little sleeves that then you would put onto the implant itself. Those right there on the Zerpic would detach after a while because they pretty much just glued on.
Yes.
Yes.
And bacteria will go in there, they will detach, and now your prosthesis is going to have movement. And if you don't come to your dental provider, your dentist, fast enough, then you're gonna put some sort of lenience on the implants that are grasping onto it. So then they can pretty much after a while, a short period perhaps, can ruin your dental investment. So now with this technology, we'll be able to take and do that direct connection, which means there's no sleeve. So that cannot be detached unless your abutment would break off or anything like that. So it's a lot more of a secure thing for our patients. And let's talk about the looks. They look amazing. Like we'll put some pictures up here. They look insanely real. They look so they to me they give me the wow factor, because everything just looks so clean. Everything just looks so easier to clean, like you said. Like here, it's just so easy. That's where the water pick comes in.
Easy, yeah.
Boom, clean, ready to go. And back in the day, we used to push back a lot on zirconia because of weight. Has that changed any?
And there's different type of discs of zirconia, but they are heavier, but not to a point where the patient's going to feel the difference when they have it inside their mouth. They're not really going to notice that something weighs more than the other because they're attached to the implants, and the implants they don't have nerve endings, so there's no reception to pressure. So patients don't really feel the difference as far as weight. It is a little heavier, but the pros of that is that it's stronger. So
what about for those clinics that want to sell you like a metal acrylic, and they say that zirconia is too heavy for the type of bone you have?
I think
Yeah, basically it's a heavy material, but that's why it's very important that originally planification is the most important.
Well, most likely it's because those clinics don't do the type of procedure you guys do.
For sure, yes.
Because how many times have we seen all on fours just tiny and just like boom, 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 no angulation,
Yes.
no planification.
If I'm gonna do a snap denture, we cannot use a long implant. We can use a small four or three small implant. But if I'm gonna do a big structure,
Something permanent.
yes, like zirconium or Cerapic, we need to do another planification. Probably 6 implants, probably 4 implants, but with different angulation, different position, a little more long. That's why it's very, very important, the first planification.
That's why it's very, very important to go to a full arch clinic, because the planification is key.
yes,
Is go to a place wherever you decide to go, whether the gentleman who's gonna do or the lady that's gonna do it is the one that's gonna do the second portion also. Because how many times did I see in my lifetime here at the clinic that I've heard about these places that I do the implants, I place them where there was bone.
Yeah.
I feel bad for the guy who's gonna do the prosthesis, and the guy from the prosthesis is like, "What do you do? Like, how am I gonna make this look good?" You know,
or work.
And the guy's like, "Well, I just did it." And you guys, if you guys do your patients, or here at Supreme, with the people that touch our patients, you guys are actually planning and thinking how that's gonna help or not help your prosthesis.
Right. It's the approach that we have. It's a prosthetically driven surgery, right? Prosthetically driven. We're always thinking about the teeth that are going to come afterwards. That's how our surgery is going to be guided. So it's always prosthetically driven implants, but powered by surgery. So we're always thinking about the prosthesis first. That's why if you're going to place an implant where there's bone, but it's not going to give you any function, then why place it? But that's why we tell patients, like, we want to do something that we make sure that you see the difference, that it feels better. We're not just going to do something just because. Right.
So zygomatic implants and pterygoid implants are for these type of prosthesis.
Yes.
Yes.
You're telling me that I cannot do a zygomatic implant for a crown?
No,
No.
not for an individual crown.
No.
Hmm.
Nope. Why?
Because I've heard of things like
It's for
that.
the angulation. When we have a zygomatic implant, we need to use maybe 40, 45, 55, or 60 grades.
Degree, yeah.
Degree, yeah. And we don't have any abutment for a single crown with this angulation.
So
Yeah.
all these things you guys have learned is to give everybody the best option of them having teeth again.
Yes.
And keeping them on, because a lot of these places can do all on fours,
There you go.
and they could walk out with them, but then we'll see you again in 3 months, 6 months, 8 months, a year.
That's the thing. Yeah, everybody could just place it on, right? The thing is not doing the surgery. The thing is making sure that whatever you offer lasts the longer.
To long term, yes.
Yeah, you want to protect your investment.
We want long-term success. We don't thrive on a year of things working. We want more than that.
Yeah, no, we've been here for 17 years. And we don't want all the warranties to come back. That's crazy. That's crazy. So, well, obviously that's the cost. You guys flying everywhere. You guys, I mean, obviously you guys are paying for all your flights. You guys are there paying attention for everything to happen. I mean, it's not easy. Also, when you guys are there, you guys are learning. You guys are gaining knowledge, but you're losing money. But you're doing it to be able to help that patient that was told somewhere else, I can't do it.
It's also an investment.
It's not possible.
It's also an investment. So,
Oh, definitely.
I mean, you're losing money in the fact that you're not at the clinic,
Right.
And that the courses, they're expensive courses.
They are expensive.
They're really expensive courses.
And they're like not across the street.
Nope.
Oh,
No. I was actually talking to a periodontist that she comes and does periodontal work for us.
Dr. Pamela?
Dr. Pamela, and she asked me how much was the Zygo course, the week for the Zygo course. And I told her the amount, and she's like, that's what you would pay. What you paid in a week for that course is what you would pay on a 3-year program for doing a specialty here in Mexico. So whatever.
But you're a baller, though.
Well, it comes with the territory, but it comes with the territory. I mean,
Right.
$100 for me is $100 for anybody out there, right?
Yes, exactly.
That's the way I see it. $100 is $100 anywhere. So that if we put that into perspective, the courses that we're taking now are really expensive,
really expensive. Yeah.
but we do it because we want to make sure our work is the best, and we want to compete, and we want to make sure that whatever we give the patient, because we know the patients are going to go back home. Some of them, not all of them, their dentist is going to take a look. And we've had dentists where they go, wow,
Yeah.
whoever did the work did a hell of a job.
Right.
So and as you mentioned, we're always underdogs, and if we give them great work, that's all there is to it.
And the thing is, you guys are at such high level that you guys can't learn what you're learning across the street.
No.
You guys have to go to another place of the world to learn it because you guys are so high in what you guys are doing. If you could take a course that's really going to benefit you really close by here, you're in a different level. Yeah. You guys are going, it's like a video game,
Right.
The more you advance, the harder it gets, and you guys keep on advancing to different parts of the world. I don't know what's next, because you guys going with Juan Gonzalez, with Dr. Vanderlim, like, I don't know, I mean, those are, you met Dr. Sinada. You guys took a picture with Michael Picos, if I'm not mistaken, and Mykonos. Like, just listen to that. When you guys were in Mykonos, like, people dream about going to Mykonos. Some people don't even know Mykonos exists.
Yeah.
And you guys were there, and you guys were learning, and you guys were around the best that there is in the world.
Yeah.
In the world, not in Mexico,
In the world.
not in Algodones. Like, some of these people read the books that you guys read.
Right.
Wrote the books that you guys read.
And some of the people that were there as attendees like us,
We're also masters.
were also masters. They give courses around the world. So that was pretty crazy. Like, I met Dr. Pedro Rodriguez. He's from Portugal. I met him in Brazil through Juan. We met him there because he's also giving the course. And he's like, oh, you went to Mykonos? He's like, yeah, I went to Mykonos too. I was actually taking the course. And he gives courses. So it's like, that was a really big moment, because he's like, okay, so that's the way I felt it. He's like, okay, he's here with Juan, right? He went to Mykonos, so this guy really knows what he's doing. And since then, we hit it off, send him messages, questions, or vice versa. So it really puts you out in the dental world, the type of courses that you're attending.
And it also puts in perspective the type of person that he is. Because if he's going to those places and he's actually really good, like, at what point do you say, I'm just too good, I don't want to go to these courses anymore? These guys are still going to it.
Right.
Because they're still learning. Iron sharpens iron, and I say it all the time. Like, there's nothing better than learning from the best.
And it was crazy, because I don't know if you remember Michael Picos. He was giving the lecture in Mykonos, and he's like, oh yeah, and last year I went with Dr. Pedro Rodriguez.
Yeah.
Remember? And he's like, to learn the palatal approach. And Pedro Rodriguez was there as an attendee. He wasn't giving the course. and the guy like giving the lecture went with another guy that was just there to learn. So everybody's like learning from each other.
Yeah.
It's a pretty cool network.
All people on Mykonos has a lot of experience.
Yeah, we were the youngest ones
Yeah.
there. It was we looked like kids.
Yeah.
Everybody's like, yeah, you guys waiting tables? We're like, we're actually here for the course.
They're like, can you bring me some more guacamole, Jose?
more water, please. More water.
Agua, please.
Agua,
Agua, por favor.
Por favor.
Por favor.
Por favor.
No Nintendo. Thank you.
No Nintendo.
Well, guys, I mean, obviously, I wanted to make this podcast so we could talk to our patients and let them know the differences and explain to why we've changed. Because you know what? To me, it's so I'm gonna say so important to know when something is different and you don't stick to the same things just because you've talked about them before. Like if I say this is right, doesn't mean it's gonna be right in the next year, in the next 2 years. You can say, you know what, I thought I was right, but now I found something better, and now I understand why this was not the best option, but this now it is.
Oh, maybe you were right at the moment.
I was
Yeah.
right, exactly, but now we advance so much that now we see
In that
Yes.
moment, yeah.
that there's something way better, and with backing up with your guys' knowledge and technology. And like I said, it's not like we're making things up. Like this is what people are the best are doing in the world. So I always I talk to our agents. I talk to Luceli, Luis Olivas. I talk to Jessica Carranza, to Ernesto Carranza, and I let them know. I tell them, look, when you guys speak to our patients, or to patients that are asking for information, and they try to compare. If you want to compare apples to apples, then don't compare us to the other clinic that you're looking at going across the street. Compare us to that clinic that you didn't want to pay for or that you couldn't afford back in the U.S. And I could probably bet you that 7 or 8 times out of 10, we're going to be better than that clinic also. Because a clinic that has the technology that we have in the United States, that has the doctors that know the things you know, but in the United States, and they have their own lab and their CAT scans like we do, are going to be way more than 50% more expensive than us, by far. But if you're going to a clinic in the United States who doesn't have the technology, who doesn't even have the specialist there, and they're going to charge you way less, you can't compare us to them. You can't compare us to them. Go get somebody else across the street and compare them to them.
Yep.
But don't compare us to them. Just because we're in Mexico doesn't mean that gives us some sort of -4 points because you're in Mexico. It doesn't work that way. Disqualify. You're Mexican. You guys are so smart. You guys are real people. Like you guys actually care. There's doctors out there that don't care. There's dentists out there that make their money and that's it. But you guys, when something happens that is not what you want, you guys torture yourselves. You torture yourself. We sat in my office many times and you're just like, hey man, I was wrong about this. And it could be like another decision that we made, not overall like somebody's mouth overall, but
Oh yeah.
and we understand that things go, you guys do what's right based off of the obviously technology and everything you guys have seen. And even if it's a perfect scenario, things still go wrong sometimes. But it's not about doing the things the first time. It's about what happens. Everybody has a plan till they get punched in their face. What happens when things go wrong? Are you like, ooh, whoops, no, never mind, sorry, go somewhere else? No, we're going to deal with it and we're going to solve it. And that's the place that you want to go to. That they're going to be with you on your dental journey from the beginning, during, and after. If anything happens, we're going to be able to take care of you.
Yes. And complications are part of life. You could plan and you could do the best. You can have the greatest surgery and still things can go wrong. And that's the difference between, I think, a great clinician and someone that's just starting off, that anybody could do a procedure.
Yeah.
But solving complications, I think that's really what makes you better. And I think with Luis's experience, I piggyback a lot of his experience to see, because he's seen it all. Like whenever I have a complication that has leaks, he's like, oh yeah, had one time or 2 times.
You're calling him old? Is that what you're telling?
Yes, old. And,
Oh my gosh.
but he's really young though.
Well,
For the type of experience that he has,
yeah.
honestly, I mean, I don't think, I'm pretty sure there's not a dentist, I'm willing to say
YouTube.
in the world, Honestly. In the world. At his age, with the type of experience that he has, I don't think there's someone out there that has his experience.
Is he flirting with you, bro?
Oh, yeah. Thank
Dang.
you.
I just give him his... No, but it's true. It's
That
true.
is awesome.
How old is he?
Are you 32?
33.
Dang, you got... when did you turn 33?
Last June.
Dang, you're getting old, bro.
33. How many implants do you think he's placed here at the
I
clinic?
don't know. Thousands.
Just
Thousands. I don't know.
Thousands.
I mean, off the top of my head, I don't know. It's crazy. I'd have to pull that up. You put me in the spot. I don't know, but thousands and thousands and thousands.
how many crowns did he...
Oh, too many.
Too many, yeah.
Too many.
And he's 33.
And yeah, I mean, I remember one week you did 133 crowns.
150.
151 crowns and like 32 implants or something like that.
Yeah.
And that was in 1 week.
When does it
One
matter?
week. I remember one day, 3 surgeries, 3 different all-on-4s.
Yeah.
3 different
I remember
patients.
you would tell me, oh, and we're like, damn, bro, you're like, just hook up some IV on me and I'll keep on going.
It's my time. It's my turn. Please.
And the thing is that he's still the same guy with everybody. Like, he's
Yes.
still like, hey, how can I help you? And he's like, oh, he's very personable. He doesn't like, oh, just don't talk to me. I'm Dr. Luis, like, and that's probably what makes people look around and it make you, they see like, oh, but look at Dr. Luis, like somebody that has your type of work and everything.
Yeah.
It's probably like different. Like, hey, I don't want to talk to you. You talk to everybody.
It's because the experience don't depend of the age, depend of the cases we have.
Mhm.
If for example, my teachers, my professors, has maybe 50 surgeries on his life, but maybe 10 years on practice. But I have maybe 50 all-on-4s in 1 year. It's because depend of the experience with the patient. Here in supremedental, we have a lot of patients. Every day is a different patient. Every day is a different history. Every day is a different challenge. We have the opportunity to check a lot of X-rays, a lot of different CT scans. That's why we have experience for the work. It's too much work.
Wow. How old are you?
I'm 31.
Do you think there's another person that's 31 years old that has this type of talent?
This man is a surprise for me. Honestly, he is amazing. You are my 31. You're very, very young. And you are doing zygomatic implants, 2 years with pterygoid implants. You start with the pterygoid implant when? 29?
About 29.
29? Wow.
29.
Yes. Probably Dr. Elias, he is one of the best doctor in Mexico or here in his town. He's a very, very good doctor.
Thank you.
I trust you.
it's the platform that we're able to perform on,
Yeah.
We're given a platform where I think he's taken advantage of it.
Yeah.
I've taken advantage of it also. I think Alonso has taken advantage of it also.
Yeah, but you guys are putting a platform doesn't mean you guys are where you guys are just because of the platform.
No, but it's a great platform to, like, if you really want to do it.
That's the thing. You really want to do it.
But you're giving the platform to perform and to shine, and we've taken advantage of it.
And you know what's beautiful? When people get together that really want to get it done. Because those are the type of people that push each other to the next level.
Yes.
Yeah.
It can be in technology. It can be in business. It can be in dental. You're like, you know what? He's got my back. He's got my trust. I'm going to give him my all. And the other guy's like, well, you got my, you're doing it. I'm going to give him my all too. And you guys just keep on pushing and going forward and going forward. But yeah, you were the first one here to bring the zygomatic. You were the first ones here to bring the pterygoid.
Yeah.
And I mean, you guys always talking to each other. Like,
and you don't get that because in the medical field, it's egos are very, very high. We run very, very high on egos on the medical field. But I think he has set the example because he's been here the longest, and he's always been very welcome to when I came in. Because I'm a direct competition to Luis, like we do the same thing.
Yeah.
But he was very open to his experience. He was never shy of showing me things or like, oh, I'm not going to show you this. I'm not going to show you that. He was like very open to it. He didn't know how good he was. It was like, to me, I was just blown away how he was showing me his CT scan, but he was like afraid. And I was looking at the CT scan. I was like, damn, this guy's good. But he didn't know how good he was because he was so wrapped into his work that he didn't. he's very hard on himself, right?
And you got to be your worst critic.
And he didn't see how, if he compared his work to other dentists, how good his work was. And but he's recently started to believe on himself.
There you go. You got to fly high with the eagles, not low with the egos.
Yes.
Thank you, because you push me every day.
Thank you.
Thank you.
See?
What's going on right now, man? Well, thank you so much, guys, for being here today.
Thank you.
Thank you.
You know, you guys are an inspiration. I believe you guys are an inspiration to many people here in Algodones. And if anybody watches this podcast in Mexico, to many people in Mexico also. If you guys can do it, I'm not going to say if you can do it, everybody else can. But if you really push yourself, that's the only way you know exactly what you're capable of doing. So thank you so much for being here at Supreme Dental Podcast Studio, powered by Supreme Dental. And just like these very talented dentists, keep on smiling.
That's right. East Coast.
And if you don't know, now you know, you know.